Hey everyone, welcome to Module 13's Learning Materials, where we're going to be talking about healthy food environments. After a semester of looking at our somewhat fractured food system, some might say, it feels really good to be coming into the last part of the semester and thinking about what healthy food environments look like, what's being studied, and interventions to increase access to healthy foods. So, examining food environments proves to be really an extremely helpful way to understand routine eating behaviors and possible intervention points to increase access to healthy foods. So, providing healthy food environments can empower individuals to make good food choices and shifts the focus away from blaming the victim and focuses on structural influences on the diet, which can include the role of governments and businesses in their role in how we eat. So I think one of the most the most powerful things and exciting things about examining food environments is that when improvements are made to increase healthy foods in increasing healthy food environments, they have long-lasting effects, or have the potential to have long-lasting effects. So having a full-service grocery store in a neighborhood, perhaps that is in great need of one, can have have a very long-lasting effect on the access to foods for that neighborhood, for example. So to start things off, I wanted to show this figure from the book. This is from the Neff text on page 427. And it's the socio-ecological model. It kind of visually showing all of the different levels of framework to depict why we eat and how we eat. So we know that there's a number of factors which we've talked about this semester, ranging from the individual level and social environmental levels in terms of networks, and all the way up to the physical environments and macro level environments. And this is the part that we're going to focus on today in terms of thinking about healthy food environments and what food environments look like. So having to exploring homes, work sites, schools, childcare, neighborhood and communities, and as well as restaurants and foods, supermarkets and convenience stores. So all of the food access points that are in our physical environments that influence how we eat. And also at the top is this micro level environments having to do with societal and cultural norms, as well as marketing and media and economic and distribution systems, and then all of the practices and legislative and regulatory elements that play into this. So really kind of looking at more of a macro, at the more macro level of what influences our eating behaviors. So food environments refer to all aspects of our surroundings. This is homes, our schools, workplaces that influence our diets. This includes the built food environment, for example, food retail stores, restaurants, farmers markets and gardens, as well as the streets and access to transportation to get to those spaces. A few notes that I wanted to highlight when talking about food environments is that we know, and we've talked about this semester, that social inequality exists in the built food environment in terms of having access to fresh fruits and vegetables and good food. We know that there is great disparity in where in regard to good food access points in these food environments. Also, as we've talked a little bit before in this semester, interventions are really needed. Interventions need to be kind of like these multi-pronged approaches. And even though this is easier said than done, the best approaches are when there are these collaborative multi-stakeholder and multi-pronged approaches, for example, with local, state, and federal coordination to support retail and restaurant interventions to create healthier food environments. And then lastly, I wanted to note that while food environments, there are increasing number of studies that examine food environments, for example, using GIS to locate farmers markets. or retail stores, and to examine from a more macro level what a certain geographic area looks like in terms of their food environments and how that relates to healthy food and access points. A lot more is needed to actually measure food access and the determinants of consumer choices. So how and why people are making the food choices that they're making. I included an example here. This is the built environment, and this is some data from Colombia on farmers market and slaughterhouse locations, which is a really interesting example in Manhattan if you're interested in exploring that. Also wanted to show you the Economic Research Services of the United States Department of Agriculture has all of this aggregated data for the United States among a number of different indicators, which many of you have explored and used the data from this. But I think it's another really good example of using data at a more macro level to examine food access points and healthy food environments. This, I just went and took a quick snapshot of Chittenden County, and the indicator here is farmers markets from 2018 with a count of 16. So there's a lot of really interesting data in this interactive map, and it's a good example of how food environments are being analyzed and hopefully also used to think about what interventions are needed when it comes to increasing healthy food environments. So then lastly, I wanted to simply go through some of the intervention examples that were offered in this week's material. So starting with the home in terms of a built-in environment, I thought it was interesting that the literature shows that to reduce sugar-sweet beverages, there was a pilot that was done with overweight and obese teens, which used a delivery system of calorie-free beverages, and it showed that there was some promise with this pilot in terms of having a delivery system with calorie-free beverages to reduce that intake of sugar-sweet beverages. So an interesting idea there. In the school system, we know that reducing consumption of high-fat and high-sugar snacks is needed and has started, but we really need to make sure that there's no competitive food locations like snack bars or vending machines in the school, and this really improves the intake of fresher fruits and vegetables and healthier foods without having those competitive foods available in schools. The workplace, increasing fresh produce consumption by subsidizing fruit and vegetables in cafeterias. We know that from a 3-week experiment in one workplace cafeteria that when the price of fruits and vegetables was decreased by 50%, there was actually an increase in the fruit and vegetable consumption by 3 times during that period of time. So increasing fruits and vegetables by subsidizing those foods is another interesting intervention. In the retail sector, increasing access to farmers markets and community gardens, and also increasing community-based distribution sites like at churches and clinics of fresh foods is another important intervention that can really help with healthy food access. We know that regardless of socioeconomic background or race or ethnicity or any other demographic characteristic, that people do desire fresh, healthy food. So there's no disparity when it comes to desire of good food, but there are disparities we know in terms of access. So really increasing kind of direct markets and increasing the access to good, healthy foods is needed. And then on the restaurant example that I pulled was increasing healthy food options by changing zoning codes to limit density of fast food restaurants. This is more of an idea at this point than an actual realized intervention, but I think that with coordination, this and using food environment data to increase healthy food environments, it certainly could be something that could be actualized and seen to increase healthy food environments by decreasing unhealthy food environments. So there are a lot of interventions that are possible and that have been tried. And from a public health perspective, It is going to take a number of interventions to mitigate the undesired outcomes in terms of diet-related diseases, for example. So just a few examples here, and I'm sure that you can come up with a number of other good interventions to help increase healthy food environments for everyone. Thanks.